And with us on the telephone today, Imperial County Public Health Director Janette Angulo. Good morning, Janette.
Good morning, Carroll.
It's another beautiful day in the valley, isn't it?
Indeed it is. Very beautiful day.
Okay. Well, every day is a good one. Let's see. What's new in the world of COVID-19 in Imperial County? Well, the way I look at some of the numbers, we have seen some improvements, haven't we?
We have. If we compare it to many weeks ago, yes, we have great improvements in Imperial County. Case rate, testing positivity, overall hospitalizations. Yes, great improvements, Carroll.
One of the things I have noticed and that I do track is the number of COVID patients in ICU or on ventilators. And those numbers have been going down steadily. And that is a very positive sign. And part of it may be, again, medical providers, physicians, healthcare providers are getting a better handle on how we treat the COVID-19. So, we are making progress. What else is new?
What else is new? A lot is new, Carol. We now have a blueprint, a new mechanism, and it's color-coded.
That's what I call the Skittles plan from Sacramento.
Yes, so some colors were added, and a map is now available. And if you haven't had a chance to look at it, it's in the covid19.ca.gov website. And if you click on county map, it'll take you to California map, all counties, and then if you click on Imperial County, it'll give you some information and about us. And just really quick, so it's a 4-tiered system, color-coded. Purple it means that there's widespread, COVID is widespread in the community. Red, there's substantial spread. Moderate is orange. And minimal spread is yellow. So Imperial County currently finds itself in the purple tier, which is widespread.
Okay. And the way it is set up, it's very clear. You've got to maintain where you are for, 3 weeks before you can move. And even after that, you have to wait, right?
So let me tell you a little bit about that mechanism. So every county in California is assigned to a tier. Currently, it's based on testing positivity and case rate per 100,000, and both are a 7-day average with a 7-day lag. Now, each assignment is, at a minimum, counties must remain in a tier for at least 3 weeks, yes, and we need to do that before moving forward. Now, what the state of California is going to do is review the information weekly, and tiers will be updated on Tuesdays. And for any county in California to be able to meet, the next tier's criteria, we have to meet it for 2 weeks, consecutive weeks. Yes, and if we worsen, metrics, then we have to go back, become more restrictive. There's no more restrictive tier than the purple tier, but there could be adjustments done. So say we have another situation like May, June, July, then at the local level, we would work with our hospitals, with our stakeholders, and determine what kind of additional measures need to be taken. But let's hope not. Let's keep moving in the right direction.
Okay, and are we moving in the right direction? Again, the state has established these metrics, and you understand them. You're the county health director. But John Q. Public, how do you interpret where we are? And are we on our way to opening up a little bit more?
So, Carol, we all have perspectives, right? And we can decide to see the glass half full or half empty. I decide to see it half full. And I don't get tired of saying May, June, July. We were in a dire situation back then. We had percents in testing positivity in the 30%. We had case rates in the 800s. We were in a very critical situation. And if you see us now, the percents are, they range. This situation is very fluid. 14, 12, 10, 8. We were at a time where we were at 7. Now, let me mention that because the state changed some of the definitions for the metrics, we had to pull down our local dashboard, which we will put up eventually. We just need to make sure that we match up the formulas and the definitions just like the state has done, so that we are comparing apples to apples. So we pulled it down. We did provide, a notice, but we plan on putting it back up. And that's in the very near future. But if you ask me, have we made progress? Of course we have. The hospitals alone, we're not seeing the numbers. The transfers out of county are not happening like they were happening a few months ago. So that's a great indication. Now, when we talk about opening, you know what? This last week, or was it during the week? I lose track of time now. But hair salons and barbershops are now operating indoors. They couldn't operate indoors before. The restaurants, they have takeout. Some additional businesses have been able to reopen, like the mall. They can do indoors with a max capacity. There's some, modifications that they have to do, which is close common areas and close the food court area so that we don't invite people to congregate. So, yes, we are definitely moving in the right direction in a very, cautious approach, a phased approach. And that's good because, again, we don't want to overwhelm our emergency response system, our hospital.
Okay. One of the issues, and I'll go back to a statistics class at San Diego State, and our sample size makes it difficult to, not to get an accurate number, but because it is relatively small, you can see larger fluctuations in percentages where, not indicative of pure numbers. Looking at it from a mathematical standpoint. So, the testing positivity rate could jump 3 or 4% in a day, and it's part of it has to do with the, a minimal sample size.
Mm-hmm. Right.
Is the state taking this into consideration?
They are. They've actually added an adjudication process to all of this. Because that's something that the state says over and over again, locals have better data. And that's actually what happened with the last process that we engaged with the state, which was, remember, the variance. We always talked about the variance, which is no longer applicable. But, the state had higher numbers for us. And because we made a good case and we knew what was happening on the ground, they accepted our data and we were able to move forward. That didn't last long because the state made additional changes, but that's a good sign. They are open for conversation. And again, they have an adjudication process that they've added to this new system, which is really good.
Okay, one of the things, again, I've noticed about the Skittles system in effect now is it has taken... it has given the state even more control over individual counties and in what they can do and when they can do it. People look and say, well, hey, ignore what the state is saying. It's not quite that easy, is it?
No, and you know what? I guess that's, again, a matter of perception. For public health, and I'm going to talk about local public health. It's really about the health and safety of people. It's really about lives. We don't want to lose another life. And, doing a phased approach, which we had already talked about locally, is a good approach. And if you take a look at what is currently opened, it's pretty much a lot of our sectors, many of our sectors are now open. It's just those huge venues that call for gatherings, those are the ones that are still closed. And I understand. I completely understand the frustration. But you know what? This is my way of thinking. I think I can wait 2, 3, 4 weeks and not lose a loved one's life instead of trying to rush. And you know what? I end up losing my child's life, my partner's life, my parents' life, when I could have waited just 2 more weeks, because you know what? I can't bring them back after they're gone. So just again, it's about perception. It's about safety. It's about keeping this community, moving forward, but in a very cautious way. And again, always the priority, the health and safety of this community.
Okay, and like you, I do prefer to look at the positive side. What the heck, I'm a life member of Optimist International, so I do see the glass as half full, and looking at the positive side of that, and the progress that we can make. One of the things, facial coverings are still mandatory. And one of the things that you point out, that face covering isn't so much for you, it's for everybody else. And I don't think the problem that some people have had with facial coverings in other parts of the state or the country has been shown so much here in the Valley. I think people, for the most part, when I'm out and around, they are wearing the facial coverings. And again, it's not for you to, it's protecting everybody else. And that's one of the keys.
Yeah.
Let's change the topic a little bit. Still same topic, but a little bit different direction. CDC says, get ready, we're going to have vaccines. Is the county preparing for the possibility of a COVID-19 vaccine coming through in November?
We're always preparing, but not for the COVID-19 vaccine just yet. We know it's going to come. And just like the H1N1 vaccine efforts that we did years ago, I do anticipate the same thing happening this time around. What we are preparing right now is for flu vaccinations, which we highly encourage individuals to start getting the flu shot, which actually we did a scan of our local pharmacies, and the great majority of our local pharmacies are already offering the flu shot. And many times, insurance, covers the cost of the flu shot. Now, for the public health department on a yearly basis, the state sends an allocation of flu doses, which we have just a few clinics, and then the rest of the vaccine we do share with our local medical providers. So we work to allocate flu vaccine to our medical providers so that they can help us, give that vaccine. But this year, what we're planning on are drive-through vaccination clinics, and some of you might remember those from the fairgrounds. And I truly enjoyed those drive-through flu clinics. So we're in the planning phase. We're going to invite partners because this requires a lot of manpower. And again, we're hoping that these happen at the fairgrounds once again. And they'll be later in October and November.
Okay. And that's where I was headed with the COVID vaccine. I know flu season, it's here. And I know you're always prepared for that because every year I go by the health department to get my flu shot. So,
well, this time it'll be a drive-through, Carroll.
Okay. Very good. Did we miss anything?
Labor Day. Can we just talk a little bit about Labor Day? really quick. And that tier system, the color-coded system, there's a lot of helpful information in the state website, including a matrix of what, is open in the next tier. And if you go through it, you'll see that if we meet the milestones, a lot more is going to reopen. But what is it going to take? Prevention, Carroll. We need to continue practicing, all those prevention measures, and more so this long holiday weekend. Wearing a face covering, yes, very, very helpful. And this community has done an amazing job with that. But not only that, washing your hands regularly with soap and water, that distance, keeping that 6-foot distance at least when out in public, mixing with people is critical here. Try not to mix with those that you don't live with, because you really don't know if they're infected with COVID. Remember, some people show no symptoms whatsoever. And then clean and disinfect frequently touched areas. And then finally, stay home if you're sick. I know it's hard. I know it's tough. But now we can do quite a bit of stuff outdoors. We can go out and exercise and visit some of the campgrounds. But stay with your own. Try not to mix with others because, we don't want to see another surge in 2 weeks from now.
Okay. Janette, we appreciate the visit today. And, I guess the way things look, we're going to be doing this again next Friday and probably for a few more Fridays.
Oh, boy. Let's hope not. Let's hope. I mean, it's a collective effort. We're moving the right direction. We just need to move together. So thank you so much again, Carroll, for having us.
Okay, Janette Angulo, the Imperial County Public Health Director, with an update on COVID-19. You have a safe weekend and stay cool.
Thank you, and you too. Bye.
Coming up, another great mix of oldies. 12:30 KXO.